محاضرة اليوم عن موضوع غير تقليدي هو Aesthetics in Ophthalmic Plastic Surgery. And let's start by saying that the subject is all about beauty. Confucius, the well-known Chinese philosopher, has been quoted to say, everything has beauty, but actually not everyone can see it. So in this lecture, I am going to talk on three subjects. The first is what is beauty to common people, and the second is scientific identification of beauty, and finally, ophthalmic plastic techniques that serve in beautification. First is what is beauty to common people. Actually, a person is said to be beautiful when their image is perceived as pleasurable and when they have harmony with nature and emotional well-being. Beautiful objects, again, are these objects that are pleasurable to perceive. Another quotation from the 18th century is that beauty is subjective, meaning it is in the eye of the beholder. It belongs to the one seeing beauty. Beauty actually is broken down into inner and outer beauty, and inner beauty is the inside of a person. It is the immaterial part seen by psychological factors, type of personality, grade of intelligence, grace, charm, and elegance. Outer beauty is the physical, material part of it, seen in good health, youthfulness, symmetry, averageness, and complexion. However, we should always remember that standards of beauty always are evolving. A young person is perceived as beautiful, having smooth skin, well-proportionated body, and regular features. And here's a comparison of the same face when youthful and when aged. When averageness or koinophilia is there, a face is perceived as more attractive. And this has been used in computer studies in overlying faces to generate mathematical averageness. This is how the averageness of the face gives the impression of beauty. If it is asymmetrical and irregular, as seen in the middle two photos, whether this is vertically asymmetrical or horizontally asymmetrical, this is not actually said to be beautiful. Another computer-generated facial symmetry to define how a person's face is beautiful. Here, an object symmetry is perceived as beautiful. Standards of beauty are either universal, cultural, or individual, and universal perceptions are common to all human cultures. Cultural differences are socially variant, and finally, individual is the subjective preference. This red flower here is perceived by everyone and everybody as being universally beautiful. And this is a funny figure of ugliness. Definitely no one will see this as being beautiful. Cultural and social aspects, as you can see, the dress code, the ornamentation, the different accessories define how beautiful a face is, and this is different from society to another. Beauty is commercialized via the media, and we have seen the ultra skinny models who are promoting eating disorders, white women promoting racism. Black is beautiful group is a cultural movement trying to change these dictum. Mixed-race children have been perceived as being more attractive. Skinny models, black is beautiful, and mixed-race children. Actually, the effect of physical attractiveness bears on the employment, social opportunities, friendship, and even marriage. Humans attribute positivity to attractiveness unexplainably. Once we see a beautiful person, we inherently think that this person is intelligent and honest, although this might not be true. Now, the second point is scientific identification of beauty, and here I refer you to this book, which may explain the subject in more detail. Scientific facial mapping has been conducted on the known Western actor Amber Heard, and she actually featured 99.7% of the Greek golden ratio of beauty. The ancient Greeks have put forward this golden ratio, which is actually phi, mathematically 1.618, everywhere in nature, not only in the human face. In simple terms, the ratio between two quantities equals the ratio of their sum to the larger of two quantities. When A is more than B in ratios, A divided by B is equal to A plus B divided by A. And this was applied to the face of Amber Heard, where A is more than B. A over B is equal to A plus B over A. Again, C over D is equal to C plus D over C. And this is perceived as the most beautiful face. Applying this phi ratio, this shows how different faces have the most near to this ratio features. And these are the percentages for the different female actors, and this was even applied to male actor faces. In Britain, the most naturally beautiful face competition on ITV had 8,000 entrants with no makeup and no plastic procedures, and they found out this girl, Florence Colgate, to have the optimum proportions for beauty, as regards the face, of course, being symmetrical with mathematical dimensions. Now, the space between pupils is just under the half of the width of face from ear to ear. Florence had a 44% success, and therefore she was the winner of this competition. A perfectly symmetrical face aided in this as well. Now we shift to our part of this lecture, which is the ophthalmic plastic techniques of beautification. Ophthalmic plastic surgery has two goals, as I always say in all of my lectures. These are the functional goal and the aesthetic goal. Aesthetic techniques include skin resurfacing, Botox injection, fillers, implants, liposuction, and facelift. I'm going to give a brief hint on facelifting here, and facelifting is rhytidectomy, removal of wrinkles, where removal of excess facial skin is performed with or without tightening of underlying tissues with redraping of the skin over the face. This might be combined or not with blepharoplasty under general anesthesia or deep twilight sleep. These are the common facial wrinkles, the forehead, the frown lines in between the eyes and the glabellar area, crow's feet at the lateral canthi, tear trough under the eye, bunny lines at the sides of the nose, nasolabial folds, marionette lines at the side of the mouth, and the mental crease under the lower lip. Complications are few. The commonest is bleeding, of course, and hematoma. This might be complicated by damage to the facial nerve, necrosis of flaps, or infection. Contraindications are severe concomitant medical problems. Cigarette smokers have skin that is not well perfused, hypertensives, and diabetics as well. It might be performed through a traditional incision in front of the ear, extending up into the hairline, curving around the bottom of the ear, then behind it, usually ending near hairline on back of the neck, or through endoscopy. This is through a temporal incision behind the hairline, dissected down to the orbital rim connected to the midface subperiosteal plane. Skin is undermined over the cheeks. Deeper tissues are sutured with or without removing excess deeper tissue. The skin then is redraped with excess skin being removed, and this is judged by the surgeon's experience. Finally, the skin incisions are closed by sutures and or staples. Areas that are not well corrected by facelift are the marionette lines, the nasolabial folds, and here the Botox treatment is the choice. And perioral mounds are the choice for a liposuction. Thank you very much.